JSI Research and Training in the Atlanta office, serving as a co-chair of this august committee. Back to you, Ashley.
All right, thanks, Terrell. And yeah, I should have identified where I work. So I'm a CHW ally for as long as CHWs will have me, and I work at LSU Health in New Orleans. And with that as just some quick background, we're going to bring up some slides and tell you just a little bit about what we are going to be talking about today. So I think we can start on our third slide. Excellent. So our hope for the call today is that by the end of our discussion, you all will be able to describe some recent developments in national policy related to community health workers and identify some of the potential impacts on CHWs. We also want folks to be able to identify actions to raise CHW voice in policy, and then just hear from some of our fantastic CHW leaders about their local and state advocacy efforts that they've been involved in recently. Our next slide, please. Just a little bit about the National Association of Community Health Workers for those who may not be familiar. We were founded officially in April of 2019 after several years of planning and organizing by CHWs and allies across the United States. It was a labor of love for those of us who were involved. And our vision is that community health workers will be united nationally to support communities in achieving health equity and social justice. So our goals are always to engage, educate, expand, establish, and enhance, really focusing on CHW leadership and CHW self-determination. Next slide, please. And just want to give a quick shout out to our members. I know that we have many NACHW members on the call today. We're grateful that you're here. We're grateful that you support the organization. And we really thank you for helping to build our organization, which is member driven and really focused on uniting CHWs across gender, ethnicity, race, geography, and lived experience so that we can ultimately achieve health equity in our communities. For those who are not yet members, we do encourage you to join today. There are a lot of benefits to being included as a member, including access to voting rights at our annual meeting, newsletters, learning collaboratives, and discounts for our Unity Conference, gifts during the year. So please do consider joining us as soon as possible if you haven't done so already. Next slide, please. And also please save the date. We have our Unity Conference and annual meeting coming up in just a few months. I hope you will join us in Austin, Texas from August 3rd through the 5th. You can register online and there's an agenda online. I'll tell you all about the fantastic offerings that we're going to have, and we really look forward to seeing you all there. All right, now we'll get into it. So I'm just going to very briefly mention the names of the folks that you are going to be hearing from today. So we're going to be hearing from Milagrosa Seguinat, and please forgive me if I have mispronounced your name. She is the Executive Director of the Community Health Worker Association of Connecticut. We will hear from Lucas Allen, who is Interim Advocacy Lead from Partners in Health. Lucy Nguyen, who's a program manager at the Austin Asian Community Health Initiative. And then on our next slide, you'll see the beautiful faces of Venus Gines, who is the CEO and founder of Dia de la Mujer Latina. Gary Ringer, who's the Director of Community and Economic Development at Joy Southfield Community Development Corporation, and then finally Honey Yang Estrada, who's the president of the North Carolina Association of CHWs. And then you'll also hear from our fantastic NACHW policy team who are on staff, including Denise Octavia Smith, Angie Kuzma, and Catherine Martinez, and they will all introduce themselves in a little bit more detail in just a bit. All right, and I'm going to turn things over to Darrell.
Thank you so much. And in lieu of an icebreaker, we wanted to ask everyone a question and ask you to put some information into the chat. So please take a look at the chat and you'll see that we're asking you to add your name, location, role in your organization, whether you're a CHW or an ally. And also the icebreaker question is, What is your greatest hope, wish, prayer, or vision for the next 1 to 3 years? What is your greatest hope, wish, prayer, or vision for CHWs in your state for the next 3 years? Sorry. And that should be in the chat. And I'll repost it again in a moment as people start to put in responses. Thank you. We're going to give folks a few minutes to do that.
And as you're doing that, I'll just give a quick shout out to some of our board members and founding board members who are here. I see quickly, I saw Gail Hirsch somewhere, Carl Rush is here, Julie Smithwick. I'm sure many others that I'm not seeing, but just want to give a quick shout out to those folks, as well as many folks who are on our various committees, including the policy committee. So just want to acknowledge that we've got lots of, let's see, I see Lori Vega Redondo, one of our current founding board members. So just wanted to thank folks for their participation today and recognize that we're lucky to have lots of our colleagues here. All right, and back to you, Jarrell, if you want to share anything you're seeing in the chat or encourage anyone to join in speaking
Wow.
to us.
Wow, they're going so fast, but thank you all so much. Maybe have one person maybe raise their hand. We can have time for 2 people to share. If you're interested in sharing, please raise your hand. We'll have time for 2, and we'll call on you to share who you are and your hopes and or dreams or vision. Who would like to? Okay, Adam, I see. Okay, so I see Adam and then Sherry. You will be our 2 today. Adam and then Sherry, you have the microphone. First, Adam.
Thanks, Darrell. I just got off of a Illinois Community Health Worker Review Board meeting. It's the 4th one that they've had since September, and they still don't have their bylaws in line. And there's some tension, and I just hope that the board will be able to resolve the tension and move forward. Unfortunately, a lot of their deliberations so far are sort of opaque, and there hasn't been enough information coming out for anybody in the public to realize what's going on. So I think this is it's going to change in the next meeting, because they have to go back in person after the emergency is over. But there's some concern there that the CHW movement is being taken over by, or being sabotaged, and has been sabotaged in some other states. And I don't understand exactly what that was referring to. So I would like to hear some more information about, that process where the CHWs become more codified in the state structure, not just for billing, but for recognition. Thanks.
Thanks, Adam,
Wow.
for the systemic approach. Go ahead, Darrell.
Yeah, I was doing a wow, Sherry, because I just put Adam's information back in the chat because I know it moved up, but Adam's in Illinois, and I think there's a lot there to unpack, and so we'll have to move right now. But I think that this is something that's across the board, something we need to address. But Sherry, I'm gonna pass the mic to you back. Thank you.
Yeah, so good to hear Adam talk about the systemic and certification and what that takes. And I'm going to bring us to the individual level. That my vision is that CHWs in Wisconsin are well held, and meaning follow NACHW policy for respected, protected, and valued, that they're paid well, and that they have all the supports that they need to be able to do their fantastic work in the community.
Thank you so much, Sherry.
All right,
Thank
thanks.
you. Thank you. Thank you, Sherry. I'll pass the microphone back to Ashley, and I know that there are some discussions that we may have time at the end to discuss, particularly related to Adam's comment, but I'm going to pass the mic and move on for now.
Thanks, Darrell, and thank you everyone for sharing your vision. I look forward to reading the chat, seeing everything in there, and thanks to those who spoke, Adam and Sherry. Now we're going to get into hearing from some of our guest speakers. So we're going to start with Lucas Allen. We want to welcome him back. As I mentioned, he is the interim advocacy lead for Partners in Health US. We were lucky to have him with us. If you happen to be on the quarterly briefing last February, he provided a great bit of information. Just a little bit more about him. He's an advocacy professional who's passionate about changing policies to promote public health and health equity. He grew up in Massachusetts before working in DC and now lives in New York City. His most recent role was with the American Academy of Pediatrics, where he worked on environmental health and climate change, injury prevention, health equity, and other children's health issues at the federal level. Lucas holds an MPH in health policy from George Washington University and a BA in international studies from Boston College. So we're going to pass things over to him. Lucas, take it away. And thank you for coming back to join us again. We really appreciate it.
Oh, thanks for having me. It's so great to be here and see you all again. And I love hearing these visions in the chat and working alongside you all. And I think someone's going to pull up some quick slides. I'm going to try and go super quick to save time for the other amazing speakers we have. But just wanted to share some quick updates from some of the items we shared back in February, and also plug, I think that recording is on YouTube too, if this is your first call and you want to hear what we talked about before on NACHW's awesome YouTube page. But we talked a little bit about in our last call about how at the end of the year last year in December, Congress passed a bill to fund the government, and it also included a bill called the Building a Sustainable Workforce for Healthy Communities Act. You'll also hear it called Section 2222 because it was that section of this big government funding bill. And what this bill does, again, is authorizes at the Centers for Disease Control and Prevention a grant program for community health workers. And it funds CHWs broadly. So it's different than other federal grants that can fund CHWs work. But specific to sort of one disease like diabetes prevention. This would fund CHWs as CHWs to do a broad range of work. So that's sort of where this is. The eligible entities that can be funded are community-based organizations, health departments, clinics, FQHCs, hospitals. I did want to note, and Angie will talk about this too, we didn't get everything we wanted in this law that was passed. Because it required a lot of negotiations, but it reauthorized this program, and we can go to the next slide. Because one of the things about what happened when this bill was signed into law is it authorized the program for $50 million. But if you look at the bottom of the slide, I think of the authorization in Congress, there's all these wonky terms. Authorization is like when you have a mug, and the mug says, Congress should provide $50 million, but it's still empty. So the next step is actually appropriating the money or appropriations. And that's when Congress actually pours the coffee into the mug. And that has not happened yet. So this program, while it's been signed into law as a CDC program, there's no money out the door yet because Congress still has to go through their appropriations process for the next fiscal year. And actually fund that 50 million. So that's one thing that Partners in Health US is calling for and working alongside NACHW on. And there's still time for any of our concerns with how the program was set up, the authorization. We can still address some of those through something called report language. And you can see in the bottom a picture from in March where we did a Hill Day with many partners on this call. And one of the things we talked about was the need for this program. With that, I'll pass it to Angie to add NACHW's perspective on the program and their work there.
You can go to the next slide. Those are just some details about the CHW language in the bill. But hey, everybody, my name's Angie Kuzma. I'm a community health worker in Portland, Oregon. And I work for the National Association of Community Health Workers as the policy and advocacy manager. Regarding this bill that Lucas has just explained to us, NACHW was following this, and we did submit a letter when it was first introduced on the House side. We requested some edits. Most significantly, we requested that there was a definition of community health workers in this language, and that be based on or that it reflect the American Public Health Association's CHW definition. That version of the bill did not end up actually going through, but then the same exact language kind of came through on the Senate side, and it was the same language, so our edits still applied. And then, I think Lucas maybe had touched on this, but the same language once again actually appeared in the Consolidated Appropriations Act. That was actually a bit of a surprise to us, but we did have an opportunity fairly recently to weigh in on the distribution of that 50 million, and who knows what will happen, with our input, but we requested that additional, a larger proportion of that go to CBOs within, so using our equity lens, we really want to support CHWs working in CBOs and all CHWs, but we know that CBOs experience additional barriers to sustainable funding. So we can go to the next update.
Great. So then just another thing we touched on in February, another funding opportunity. CBOs are community-based organizations. Great question in the chat. Another funding opportunity coming from the federal government, CDC's Public Health Infrastructure Grant Program. And CDC has awarded $3.2 billion for this program, going to all 50 states, DC, 8 US territories and freely associated states. They also have funded some large cities and counties. And one reason we're interested in this grant program is it can fund public health workforce, broadly defined. So a lot of this is up to the states and how they want to use these resources. And there's a role for advocacy there. But one critical component of the public health infrastructure in this CDC grant program is the workforce. So I'll pass it over to Angie to talk about NACHW's work on this program too.
Yeah, so just briefly, we've been following the distribution of these funds and, trying to collaborate with our national partners to track that. And we're really interested in, again, this idea of if and how community health workers are being engaged in the process, and whether or not grantees are engaging community-based organizations and CHW-led networks, associations, and other coalitions. So it's an ongoing thing. Thank you.
All right, so those are grants. Now, the next piece we're going to talk about on a federal policy update is Medicare and Medicaid, which is a sort of sustained funding source that I know a lot mentioned in the chat about you're working on this. So excited to share this update. We've been working, NACHW and Partners in Health US, other partners have been working with a congressional office on a potential future bill that would support Medicaid and Medicare financing of community health workers. And you might be wondering, I'm working on Medicaid financing in my state, so what would the federal government or Congress have to do with this? One way it would affect Medicaid reimbursement is it would provide an incentive for state legislatures to do this. So if the federal government can provide states more money when they're covering CHW services through Medicaid, that can sort of help our advocacy in all of our states to get the Medicaid funding. So a big question is what services would Medicare and Medicaid pay for community health workers under this legislation? And there's two broad categories: preventive services and services to address social determinants of health. In our feedback on the bill, I think both PIHUS and NACHW have called for a broad range of services being considered for reimbursement or coverage. So that's a really important element. And just to back up, why are Medicare and Medicaid important? They provide coverage to over 100 million people in this country. As you can see, there's a little pie chart on the right. Those are the two programs on the bottom left. And so it's a really large chunk of people in this country that receive their care through these programs. They have mandatory funding, so we don't have to ask Congress to keep providing it. So it's a really exciting opportunity for sustained funding. And Medicare and Medicaid coverage can really impact how community health workers do their work. And we really recognize that. And for that reason, it's so critical for NACHW and CHWs to be involved in shaping this legislation. And so I'll pass it over to Angie to talk about the work on this.
Thanks, Lucas. Yeah, so NACHW was very pleased to receive outreach from some legislative staff regarding this support for community health workers through Medicare and Medicaid. And just, in summary, our input and our feedback about this potential legislation is essentially we want to see legislation that defines the CHW profession the way CHWs define the CHW profession. So using that APHA or the American Public Health Association CHW definition. And we want to see CHW core roles described the way that CHWs describe CHW core roles. So referring back to the language from the Community Health Worker Core Consensus or C3 project when we would talk about the roles. And then lastly, we want to see more opportunities and we want to see policies that really encourage and promote more CHW-led evaluation and measurement of CHW programs. And we're looking forward to continuing this conversation. Lastly, I'll just wrap up Lucas and I's section. Thank you so much, Lucas, for joining us and all your updates. I just want to draw your attention to the NACHW National Policy Platform, which is available on our website. And that's a tool for you to use in your advocacy. And the main components are respect, like Sherry mentioned earlier. Respect, protect, and next slide. And you can find a lot of most of the information that we talked about, well, some of it earlier on our policies page. So www.nachwa.org/policies. And there's a ton of other resources there regarding policy, especially our Community Health Worker Document Resource Center, where you can find all kinds of articles, gray literature, other types of documents, specifically about CHW policy development and some other topics. We also have our policy reports on that page. We have our statements that we have made, and there's a request form that you can use. We encourage CHW networks especially to use that form. If you're working on state level or organizational policy, you can request NACHW's support with that. All right, thank you. And I will pass the mic to Catherine.
Hi, everybody. This is such an exciting opportunity to be here presenting with you guys for a couple of different reasons. Number one, because this is my first time being part of this discussion in this panel, and I am very, very motivated and inspired by all this collective work that you guys are doing and the way you're leaning in to really understand these policies and help it reinforce your advocacy. I was fortunate enough to also join the team back in March at our Capitol Hill visit, which was great. And from there, we were able to really drive a lot of momentum. And one of the things we kept hearing from our members and our allies is that we need to have this type of effort be something that we do on an annual basis, and that we engage more of our CHWs and more of our allies to really help spread more of this information in terms of the priorities of CHWs. So to kick that off, we are launching the National CHW Awareness Week. And this is a national effort that's going to really underscore the way that this network collaborates. We're going to celebrate the wins that we have had, and we're going to commemorate the CHW strength and priorities, which is really, really important. So NACHW is going to invite CHWs and allies to the official CHW Awareness Week launch. We will do that via webinar, so it will be a similar setup like this one. And that's set to take place on June 14th from 2 to 3 p.m. Eastern time. We will be sending some updates and some reminders and calendar invites shortly after this meeting. So if you haven't seen it in your inbox, you will receive it shortly. And we're really looking to have participants be able to feel comfortable explaining the strategy of raising awareness, feel comfortable engaging local decision makers. We also want you to feel that you know where to find these tools. You know how to use these talking points to really underscore your local advocacy effort. So we really are encouraging folks that want to participate in CHW Awareness Week to please register. The registration is going to be available the first week of June, so please be on the lookout for that. And what do you get? What do you get from participating? Well, registrants will receive important updates, and then they're going to have full access to a very robust toolkit that NACHW has been working really hard on to make sure that it incorporates all of the local efforts that we have seen our members be a part of, that NACHW has led on, and really give folks the voice that they need to go into these meetings with local decision makers, knowing that they are elevating the priorities that are important. So in the toolkit, you're going to be able to find a roadmap. This roadmap is going to help guide participants through the process and the strategy of this national event. There's also going to be a checklist in there. We really want to make sure that folks know what the key steps are to be productive and to have concise meetings with our lawmakers, that we know sometimes they have very limited time. So we want to make sure we have the best use of that time. We also want to empower folks with key talking points. As we all know, policy, advocacy, all this language can be sometimes very overwhelming. So we want to make sure that you're going in there with a lot of clarity and be able to really deliver a consistent and concise message. And it's going to be a message that is not only going to represent your own local efforts, but the power of this network, the power of our CHW network and allies. And then we're also going to include templates in there. So we understand that people have questions. How do I reach out? How do I make the communication? Who do I contact? What is the right wording? How do I address our official lawmakers? Well, we're going to have templates included in there to make that process as seamless as possible. And in addition, Angie and I will also make ourselves available to connect with CHWs and organizations that are looking to understand this process a little bit better. So we are really excited. We know that the excitement is there. We want to use that momentum to go into Unity 2023 and really bring on the rally. So we're really looking forward to having this network, all of you on this call, participate and join these efforts because we really believe in the power of organizing to be able to lift our advocate voice. Thank you, Angie.
All right. Well, thanks so much, Catherine. That was fantastic information. And thank you again to Angie and Lucas for sharing. So now we're going to move on from hearing from some more of our guest speakers who are CHWs that are leading policy and advocacy activities in their states. It is my pleasure to introduce Honey Yang Estrada, who is, I think, the most energetic CHW I've ever had the pleasure of knowing. She is the president of the North Carolina Community Health Worker Association. She was born in Fresno, California, and moved to North Carolina when she was 11 years old. The eldest daughter among refugees who came to the United States during times of war, Honey understands the struggles families face in navigating various societal systems and existing barriers that inhibit them from achieving positive outcomes. A proud CHW, Honey has worked in healthcare and public health for over 20 years. Her experience is rooted in community health and advocacy throughout her career. Honey continues to serve as a catalyst for change where she champions racial and health equity. She currently lives in Newton, North Carolina with her family. She teaches Zumba at the local library, and she holds a master's degree in public health. And welcome and thank you for being here, Honey.
Thank you, Ashley. What's up, y'all? It's good to see y'all. Before I start, Betsy, I saw that your hand went up, so I wanted to hold space for you if you had a question for the folks before me.
Yeah, it is a question that have a rationale behind, and it's how do you all see this toolkit to be useful for federal agencies like CDC? And the reason I'm asking the question is because I am a member, former chair of the CDC CHW work group and the creator of the CDC CHW awareness event. This event has been approved and it's going to be happening in September. So I'm looking to see synergies between the efforts that NACHW is doing through the toolkit, but then since I haven't seen the toolkit yet, that's what I'm raising the question as to how do you see this toolkit be useful for federal agencies like CDC?
I think that's a great question, Betsy. I'll just take a quick stab at answering that, which is, I think that'll require some further discussion. So I wonder if maybe we can talk about that offline a little bit more.
Yeah, Betsy, this is Catherine. Sorry, I was on mute. I will be more than happy to connect with you on that. We can collaborate. And if there are pieces in the toolkit that don't directly address that, we can talk about that. We still are in the window of being able to add that. So I'll follow up with you.
Yeah, definitely. I would like to have a conversation around this because I am in the middle of planning the CDC CHW awareness event. So I want to make it useful, but I also want to show the networking with NACHW.
I'll just
I want
jump
to
in
use
really
the
quick.
opportunity. I want to use also the opportunity to showcase whatever NACHW thinks will be best to be showcased in that event.
Absolutely. And I think, Betsy, you're actually really touching on a core component of what National CHW Awareness Week is supposed to be, right? It's not actually one thing or one event. It's everybody doing it everywhere in their home states. And the toolkit is, we're designing it to be useful for anybody. And so, we really look forward to releasing that toolkit. We're not quite done with it, but, stay tuned. And we hope everyone can join us on the launch webinar and certainly at Unity. I think Ben asked in the chat, does it begin on June 14th? And I mean, the answer is because it's we're encouraging people to just do advocacy work everywhere. I think you can start, your preparation whenever you feel ready. I think the actual week itself that we're trying to promote is, let me see. Sorry, I think it's the week after Unity. Catherine, do you have the exact date?
I don't have it right, but it is the week after Unity.
Okay, great. And Unity again is on August 3rd through 5th in Austin, Texas.
Yeah, and this is why I delayed the CDC awareness event for September.
This is a great beginning to this discussion. I want to be mindful of time because we have a bunch of guest speakers and we really want to hear from them. So Betsy, thank you for your question and all of your advocacy efforts. Let's continue some of these discussions offline and certainly in the chat. So thank you. All right, let's turn it back over to Honey.
Okay, it's me again. Hey, y'all. All right. So check out all of the North Carolina CHWs on the slide here. I am, of course, very much biased. I think North Carolina CHWs are the most fabulous CHWs in the entire world. Want to share a little bit about our first ever CHW Advocacy Day that happened last month on April 19th. We do have just a few pictures to share. And I will be very honest and tell you all that this was the first CHW Advocacy Day that I have ever organized. I do not do this work alone. I'm so very grateful for our friends and co-conspirators, particularly the Partners in Health North Carolina team who came alongside of us to provide some coordination and coaching. And so, right now we've got the GA, the General Assembly, who is currently, they're hashing out the budget, y'all. And, we had a bunch of CHWs who were laid off at the end of last year, but very excited and proud of the fact that we are inching near 800 certified CHWs in North Carolina. So super proud of North Carolina efforts. And we felt like this was the time. It was time for us to start engaging our legislators and start developing those relationships. So we put together, we planned all of this in less than a month, and it was definitely quite the journey. But I had shared with the planning team when we were planning all of this that I would be super pumped if we had 10 to 20 CHWs show up. If we got 10 to 20 CHWs, like that'll be good. Like I'll be super excited about that. Y'all, we had over 80 CHWs and CHW allies who responded, which to me demonstrates the appetite and the leadership of our workforce, specifically in North Carolina. And we can showcase some of the other pictures. But what we did, our strategy for this was what we did, the association team did, is we engaged the chairs for the health appropriations committees. So Lucas talked a little bit earlier about what those appropriations are going to be, and really saying, hey, we know that there's money, give us some and we advocated for sustainable funding. So we, the association team, advocated for sustainable funding with the appropriation chairs. And then coupling that with getting CHWs together in teams, and that's what you see here on the pictures are the CHWs in their teams to engage their local legislators at the Capitol. So we had CHWs from Forsyth County who went together, CHWs from Mecklenburg County who went together and shared their stories and talked about what they were doing in their local communities and why funding for CHWs was going to be so critical for public health and all the things that we're moving into as we're seeing this movement take shape, not just in North Carolina, but nationally. And so very excited about the fact that we had all of these CHWs and CHW allies show up and show out. And I definitely could talk about this all day, but definitely want to hold space for the other guest speakers. And of course, happy to talk through questions, concerns, as we move forward. Feel welcome to drop me an email. I welcome your partnership, would love the opportunity to connect. I'll drop my email in the chat for you all. And Ashley, am I turning this back over to you? Okay.
Yeah. All right. Well, fantastic. Thanks, honey. That was quick. You're so efficient. I appreciate you being mindful of time. All right. Well, we are going to move on to our next speaker, who is Gary Ringer. I don't believe he has any slides, so I think for now we can stop showing the presentation and just focus on seeing Gary's face. But Gary Ringer is a Detroit firefighter who's been recognized locally and nationally for his leadership and advocacy to advance health equity. As a Robert Wood Johnson Foundation Culture of Health leader, Gary addresses environmental health disparities and environmental justice within neglected communities. He is currently the Director of Community and Economic Development at Joy Southfield Community Development Corporation. As part of a national initiative funded by the Congressional Tri-Caucus, Gary recently partnered with the Association of Black Psychologists, Inc. and the Alliance of Ethnic Minority Psychological Associations to assess mental health needs and the effects of the pandemic within the African-American community. And I should say the Congressional Tri-Caucus is made up of the Black Caucus, the Hispanic Caucus, and the Asian Caucus. Gary is one of 12 leaders from across the country who NACHW selected to for the Advanced CHW project sponsored by Johnson & Johnson. So Gary, thank you so much for being with us today. We look forward to hearing from you.
Thank you. I appreciate the introduction. Appreciate everybody's time being here, and I'm gonna cut to the chase real quick. As a firefighter, been on the job since 2000. I directly started getting involved in the community due to the lack of wraparound services and consistently going back to the same households on a regular basis. So through that advocacy back in about 2009, I just started attending Block Club meetings, and from those engagements, started meeting my local representatives, whether it be on a congressional level or at the state level. And from there, once I took the role as Director of Community and Economic Development at Joyce Southfield, I really saw the need to be able to further align our initiatives within the community and also within those elected officials. They don't know unless you tell them. So started attending advocacy day events, started going on trips up to the state capitol, local representatives, they rent buses, I sign up, I go, and then you have an opportunity not only for your face to be seen, but to also let them know, hey, this is what's going on. Back in 2021 of October, one of our state senators was at a local neighborhood organization and was talking to funds that she had allocated for various nonprofits in regards to some work that they were looking to progress. And I saw an opportunity to speak to the value of community health workers and speak to the value of community health workers within not only decreasing health inequities, but also speaking to the need to have those resources coupled up within housing repair initiatives. So we've all seen the push for energy efficiency, decarbonization, electrification. And when we speak to those issues, those are environmental justice issues, but then they also speak to climate justice. And unfortunately, as foreign as those terms may seem, our communities, the communities that we serve, are most impacted. So similar to COVID, how we all came together and we took a multi-layered approach to remediate the threat that was at bay. I think it's extremely important that community health workers are on the forefront of speaking to everything that's being brought into the community from a workforce development perspective, as well as to the standpoint of health equity and improving the quality of life within the communities that we serve. And lastly, to follow that up, due to that advocacy from October of 2021, we had a CHW advocacy day with NACHW, and that was about 2 weeks ago. And last year was the first day, and they had 40 CHWs last year. And this year we had over 120 that signed up. Approximately about 100 of those showed up to the state capitol. And while at the state capitol, while speaking with our state senator, she directly told me that she put our organization and our program, which directly employs CHWs, in her budget for the upcoming fiscal year. So I think that's a huge win.
That's fantastic, Gary. Congratulations on your incredible work, and being allocated funding is such a huge win. Thanks for sharing, Gary. I will note there is a request in the chat for your email. Our friend Terry Mason sounds like would like to connect with you. So if you don't mind sharing that with her, that would be great. So thank you again for sharing. I am going to pass things over to Darrell, who's going to introduce our next set of speakers.
Thank you so much, Ashley. It's going to be my honor to introduce Millie Seguino. She's a certified CHW who I've worked with for probably, 3 decades, Millie. Okay, I know we're she's an adjunct professor at the Gateway Community College. She's also a CHW training instructor and a founding member and the executive director of the Community Health Worker Association of Connecticut. She has served as an ambassador for NACHW, representing Connecticut and the New England region. And she served as a navigator, key staffer for the Access Health Connecticut, providing outreach and support to help enroll Connecticut residents in health coverage. She has extensive experience working with multicultural and diverse populations in Connecticut and has focused on mutual housing, education, parenting, and parent leadership, as well as chronic diseases and chronic pain management. In her long career as a CHW, Millie has received many certificates and held many roles, including as a notary public, a justice of the peace, and a chaplain, which I didn't know after all these years. Millie graduated cum laude from the University of Puerto Rico. She also attended Goodwin College for Business, and she is the proud mother of a daughter and son, and the proud grandmother of a granddaughter and 2 grandsons. With that, I pass the microphone over to Millie.
Thank you so much, Darrell. Good afternoon, everyone. Thank you for inviting me to bring some information from Connecticut and bring some updates. We have been doing a lot of work and making a lot of noise in Connecticut. So I want to start by providing a little bit of background about who we are. So the Community Health Worker Association of Connecticut is a section of the Connecticut Public Health Association. We became a section of CPHA in 2016, even though the interest and conversation about forming a network or organization started in 2009. We partner with different organizations, allies, supporters, CHWs, employers, legislators, champions, community individuals that have been helping us promote CHWs in primary care teams. And this is happening, it happened with funding from the State Innovation Model Program in 2013 and 2014. In 2016, the CHW Advisory Committee was created to be in charge of developing policies to promote the CHW workforce. Later on in 2017, with the help and guidance of a nonprofit organization, Health Equity Solutions, we have a Public Act 17-74 that became part of the 18-91 Session 63 that established a statewide CHW definition and scope of work for CHWs in Connecticut. In October 1st of 2018, the report concerning CHW certification recommendations was submitted to the legislature. Then in February 2019, the State Bill number 859 was raised, and that was an act concerning CHW's development of certification for community health worker. Later on, at the end of 2019, CHW certification became law with the House Bill 7424, and on January 1st of 2020, the CHW began in Connecticut. So if you hear all this information, this timeline, we have been working very hard to be able to get what we wanted. So far, we have around 342 certified community health workers. Certification in Connecticut is voluntary and is renewable every 3 years. The fee is $100. And the association oversees everything related with professional development to all community health workers in Connecticut. We have 4 approved training vendors providing training and core competencies to CHWs and also to those members of the community that are interested in a career in the public health field. So we are in the process of establishing a train-the-trainer program to prepare qualified community health workers to be instructors of the CHW training course. So what's next? At this moment, we are advocating to have sustainable funding for community health workers. We have been testifying in front of legislators in support of 2 bills. Senate Bill 991 and Senate Bill 10 in support of Medicaid reimbursement for community health workers, as written in Section 11 of State Bill 10. This language reflects the input of a coalition of over 100 community health workers and allies, and would require the Department of Social Services to create a comprehensive community health worker reimbursement plan that meets all of the criteria laid out by the CHW coalition. The good news is that both the State Bill 10 and Senate Bill 10 and 991 are on the same Senate calendar, and Section 11 of Senate Bill 10 should be amended to mirror language in Senate Bill 991. We have been able to do all of this work with the support of different organizations like Health Equity Solutions, the Office of Health Strategies, and the Connecticut Department of Public Health. A few things that are similar that what it was already mentioned, like for example, the toolkit, well, Health Equity Solutions put together a toolkit for community health workers to utilize to facilitate the process doing advocacy and connecting with legislators, along with an advocacy training that really help us learn the process and make it much easier for all of us. Another thing that we did that and you are talking about these events for community health workers. So on April 6th, we had a Health Equity Week, and we had the opportunity to get together for the first time after the pandemic. So we celebrated the Community Health Worker Day in Connecticut that is celebrated every year on April 7th. We did the celebration on the 6th because of the holidays, and we received a proclamation. It's like every time we receive a proclamation to have April 7th as the CHW Day in Connecticut. So another thing that we had is with the help of Health Equity Solution, we formed a CHW coalition to work on the sustainability for the workforce. So we will continue building the infrastructure and sustainability of the association. We have a lot more to do, but we will keep going with the process. We will continue identifying CHWs in Connecticut, educating everyone about the work that we do, and making sure that our workforce receives the recognition that they deserve to be able to continue providing the quality of care that our community in Connecticut deserves. Thank you. I will be happy to answer any questions when time comes. Thank you.
Thank you so much, Millie. Before I introduce the next speaker, I want to say, please continue to use the chat. And for speakers, please look out for any questions directly to you. I know the NACHW team is also looking at any responses they can do. So please keep checking on that chat. There's 2 more speakers to go, but really we just want to reiterate that this is a group of people today who are sharing a snapshot of some of the CHW movement that's happening on the ground in the States. We hope that sharing these things that are happening will provide ideas, but also help people understand this mosaic or tapestry of local movements and local action that makes up the national movement and contributes to what we're doing nationally. So I thank all of the speakers, and it's going to be my honor to next introduce Venus Giannis. And I know I messed up her last name. Sorry, Venus, I did it again. She's a 30-year, 3-time breast cancer survivor who has devoted her life to the Latina advocacy. Among Venus's many identities and roles, she's a longtime promotora CHW, researcher, certified promotora CHW instructor, and in 1997, inspired by her personal experience with cancer and her sister's untimely death from cervical cancer, Venus founded Dia de la Mura Latina, also known as DML, It's a national nonprofit that provides culturally and linguistically appropriate and proficient patient-centered navigation and preventive services to medically underserved Latino communities. She recently launched the Telehealth Community Navigation Contact Center, where a team of bilingual promotores and CHWs and a nurse navigator answers hundreds of calls to debunk misinformation, promote health equity, and provide warm transfers and handoffs to clinical providers. In 2018, Venus retired from her position as faculty member at Baylor College of Medicine in Houston, where she researched Latino medical mistrust and taught cultural competence and health literacy. I was honored to be side by side with Venus during our March 8th congressional briefing and visits, and so much power and energy. Venus, the microphone is yours.
Thank you so much, Joel. Hola, ¿cómo están todos? This is a pleasure to be here with all of you and to listen to all the incredible work of my other colleagues. First and foremost, we were celebrating Minority Health Awareness Month in April. And of course, we also, every April, we celebrate our expanding role of Community Health Worker Conference. And this was our 13th year. And we did it in Austin, and we included our legislative visits, and we had talking points for all our community health workers and promotores. And we also, the governor gave us our proclamation, and we also had Senator Blanco, who initiated a state Senate resolution 401 acknowledging the work of community health workers and promotoras, and the fact that Texas was the first state to actually have legislation devoted to promotores and community health. And so we started the conference, like I said, with talking about grassroots advocacy, and we had the training in English and Spanish for our promotoras. And we also had, like I said, talking points for our community health workers. We had arranged some visits for some of our community health workers to visit their legislator. We had our speaker, our wonderful speaker in the morning, which was Denise, speaking to us virtually, presenting the wonderful work that NACHW is doing and the support that NACHW has for our organization and for community health workers across the country. We also, after the noon hour, we had a guest speaker, then we had 3 programs, 3 training presentations for our community health workers. These were also considered CEUs for our community health workers. The first one is let me start with letting you know that DEI in the eyes of a community health worker is a little bit different than DEI for other people. So DEI, we took it and we made it more community health worker centered. So the D was diversifying the healthcare workforce, especially in health and wellness. We talked about all the roles that community health workers can play, and we highlighted with the E with vaccine equity and the I with improving inclusion in clinical trials. We opened it up with 2 career opportunities. Our organization developed the Vaccination Community Navigator in partnership with Vaccinate Your Family, and it has been state certified. And this is a training for those that want to work in the field of vaccination, from children's vaccine all the way through to our seniors. The training is now going to expand even more, hopefully, because we are partnering with a pharmacy academy that has been already approved for training of pharmacy techs, and these pharmacy techs can do vaccinations. So we are working with this pharmacy academy to do a dual training program for community health workers to also be pharmacy techs, so they can also be helping our community and getting everybody vaccinated that needs it. That's one training program that we have available as a workforce opportunity. The second is improving community health workers in the field of clinical trials, enrollment, recruitment, and also retention. Many of us know that 2% Latino and 8% African American participation in clinical trial is very irresponsible, and we want to work with our researchers in improving their recruitment skills, actually be part of the recruitment process, actually even be part of the developing the protocol so they will know how to reach our community and not spend all this money going at nowhere. The end of the training program will give you an opportunity to advance into some of these clinical research institutions as what we call a clinical trial community navigator. That has also been certified by the state of Texas as a training program and a career opportunity for many of our community health workers. And so that was our legislative day. That was our advocacy day on April 14th. We are an apprenticeship program in Texas for our community health workers and promotores. As you can see, much of our training programs is really geared toward workforce and getting them integrated into workforce. And we are looking at June 10th to have a community health worker, a job fair. We will have somebody from Lone Star College who will work with our community health workers in revamping their resumes to make sure that they have the right wording to be able to have better job opportunities within the area of public health. And there's so much that we are doing. We are on a tour, our Health Fiesta Health Equity Tour. We're starting this in Houston this Saturday with our community health workers that are already trained to do blood pressure screening, diabetes screening, cholesterol screening, HIV screening, and HIV screening. So they're going to be doing, a lot of them are going to be doing this on Saturday. We have over 600 people already pre-registered in our event. We're going to be in Chicago. We're going to be in Miami. We're going to be in San Diego. And finally, before the end of the year, we will be in Puerto Rico, which is my hometown. So I think I'll stop there. And any questions, I'll share our website and you can see the recap of the conference and also our Health Fiesta and the amazing role of community health workers and promotores in advancing healthcare. Thank you.
Thank you so much, Venus. It's now my honor to introduce Lucy Nygren. She's a second-generation Vietnamese American residing in Austin, Texas, which, as everybody knows, is the site of Unity 2023. There, she focuses on language access and health equity in her community and nationally. She is a community health worker and the program manager at the Austin Asian Community Health Initiative, also known as ACHI, a Texas-based grassroots organization working to improve healthcare access for Asian immigrant communities across Central Texas. She supports a diverse team of CHWs working across communities and languages, including Arabic, Burmese, Chinese, Chindian, English, Hindu, Korean, Nepali, and Vietnamese. Lucy is one of the 12 national CHW leaders in the NACHW Advanced CHW projects and currently serves as the past president and community engagement director of True Viet, a local Austin-based community organization providing language, social, and cultural programs to improve quality of life for Vietnamese in the greater Austin area. In her free time, which that's interesting, she enjoys spending her time hiking, traveling, and is an avid thrifter. Well, thank you. And the microphone is yours, Lucy.
Hi, everyone. My name is Lucy Lin. I'm the proud daughter to Vietnamese refugees. And growing up, providers rarely shared the same culture or languages to provide services, mainly in English to my family, and which made it really difficult for us to be able to access healthcare or other social service resources. And as a kid, it was hard for me to be helping my parents to navigate those resources. This is only my family's experiences, but I know that many immigrants and refugees also are experiencing the same thing all across the United States. I'm trying to navigate these complicated systems. I'm really grateful to have attended the Community Health Worker Day in Austin, Texas, hosted by Dia de la Mujer Latina, and be in community with other CHWs across Texas at the Capitol. Just to know, like, I'm a younger CHW. I've been a CHW for about 4 years now, and this was my first time at the Capitol speaking with legislators and representatives. So I'm really grateful to Venus for organizing the legislative visits and CHW Advocacy Day. Thank you, Angie. During the legislative visits, I was able to speak to my representatives along with many other Austin-based CHWs. You can see pictured here. And we were able to really bring attention to the CHW work in Austin and the roles that we play in grassroots community-based organizations, federally health qualified centers, and other medical settings, and really advocating for sustainable CHW funding. Something I really liked that Dia de la Mujer Latina gave us was like handouts to be able to share with us, but also to share with our legislators as well. So I think that was really helpful as a resource during CHW Awareness Week or as a CHW day in general, to be able to have these two as a tool. And I was really excited to be able to bring attention to the medical and social needs of the Asian communities that exist in Texas. They're of the immigrants that live in Austin, not in Austin, but in Texas. We speak 160 different languages, and being able to access care and not have it be available in your preferred language really limits your ability to be able to access care. I was also able to talk about other social needs, such as affordable housing for our communities and the other detrimental impacts of the public health emergency ending, and how communities deserve equitable service and delivery regardless of their language abilities. And at ACHW, we work with a diverse Asian immigrant community, and we know intimately how language access is one of the top barriers to accessing basic needs. And it's a completely, preventable barrier to ensure that community members feel empowered to make informed decisions about their lives. And when community members aren't able to receive quality care or services because of the language barrier, for example, if they're not able to schedule their own appointments because the person on the other line only speaks English, if they're not able to fill out any intake forms or applications because, again, it's only available in English, and they're not translated in their preferred language, or their doctor doesn't speak anything other than English, folks don't even try to access those resources. And that's where community health workers come in to ensure that folks can have access. And I was really excited to be able to talk about CHW roles, particularly within language justice, and really share how we are in a resource to our legislators to ensure that the bills that they put into place are considering the language access component and the immigrants that exist in the state of Texas. One of the bills that I was able to bring to my legislators' attention is a Texas House Bill 5166, which is a language access bill that's championed by a Houston community-based organization called Worry Juntos. And this bill is asking for our Texas Health and Human Services to create a robust language access plan to ensure that the needs of the immigrants in the state of Texas are being served through the state benefits. So I was really excited to be able to talk a little bit more about that and hear from my reps that they would be willing to support this bill. And so those are things that at ACHW we're really excited that folks are thinking about language access and language justice. Again, that was like my first time being able to do something like this, and I was really anxious and nervous to be able to go to the Capitol with other CHWs and have these conversations. But I think my biggest takeaway as a newbie doing this advocacy work is that I definitely feel a lot more knowledgeable just being exposed to the space. I feel more comfortable now just having that first exposure, but also as CHWs who are doing this work, we're out in the community, and our experiences equal expertise and knowledge that is beneficial to our legislators. So just knowing that I'm coming in as an expert, even if I have never done this legislative work before, it's my experiences are very valuable to be able to speak for our communities. So thank you all for your time.
Wow, so powerful. I'll pass the microphone to Catherine and/or Ashley.
Sorry, I was on mute. Wow, 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 wow. This has been so motivating to just hear all the speakers, hear the work that you're doing in your regions, underscored by your lived experiences. Thank you so much for showing up, not only just with your commitment, but with your stories and being vulnerable and using vulnerability to really draw strength. You're very, very inspiring. And without leaders like you, we wouldn't be able to do this work. I want to touch upon something that Lucy said about, just this natural nervousness that comes from being in these spaces of advocacy and policy and lifting the voices. And that's exactly what we're looking to help streamline a little bit better with CHW Awareness Week. These stories that you just heard is the main reason why participating and getting the tools that you need and practicing your pitches and knowing your talking points. This is where we're trying to empower you with the tools that you need to be able to be successful in your local advocacy. So thank you all for sharing the many ways that you are doing that. Hopefully, by participating with us on CHW Awareness Week, you feel more empowered to do so. And let's go into unity with so much energy, rallying amongst ourselves and making sure that our network continues to be strong. I want a heartfelt thank you to Ashley and Darrell for really leading us here at NACHW with all of your commitment to this policy work. And I'll turn it back to Angie to lead us off.
Sure, I think you said it all, Catherine. I have nothing to add. Let's maybe do some question and answers with the speakers. Do we have time? Looks like, yeah.
We have 15 minutes, yes. You can feel free to use the raise hand feature and we can call on folks that way. Anna?
Hello, everybody. This is such a wonderful meeting and so much, as you said, amazing energy pushing this work forward. My name is Anna Yankolev. I am a CHW ally working at the Health and Medicine Policy Research Group in Illinois. And my question is for folks that have passed CHW reimbursement policies and is going back to the comment that Adam made at the very beginning of the meeting about hearing efforts to sabotage some of those policies. So I'm curious if anybody can kind of speak to what that means and who is doing the sabotaging and how can we, help protect our efforts in Illinois from being impacted by that.
Thank you, Anna. Anybody want to jump in? Safe space, don't be shy.
Yeah, this is Adam again. I just want to offer a clarification. The comment was in the context of the representation by the CHW, which is the state association, being somehow co-opted in the process of creating rules for certification. So we're not as far ahead as other states. And it wasn't so much about sabotaging reimbursement. However, the process of certification is going slowly. So I think they want to make sure that CHWs who are, have been working at this for years don't get co-opted by some other association in the future. That's one example. Because of the way that the statute was written under which they're now trying to form the certification rules.
Thank you, Adam.
That's helpful clarification.
Ashley?
Oh, I can speak to our experience a little bit in Louisiana, just as an example. And my colleague and good friend, Catherine Haywood, I see is here. I don't know if she wants to jump in at all, but for those who don't know, Catherine, she's a longtime CHW and the executive director of LaShawn, which is our CHW association here in Louisiana. So we are having an experience right now where there is a bill pending before the Louisiana legislature to officially create a community health worker board that would advise on training standards for the state, not quite at the level of certification. But anyway, so, we have limits in terms of how much we can participate in advocacy. I, in particular, as a state employee, I cannot advocate, but I can provide information. So we were at the legislature earlier this week, as well as last week. And the representative who wrote the bill was attentive to the APHA policy as well as NACHW endorsed policy that suggests that there should always be at least 50% CHWs on any group that's making recommendations or training standards, that sort of thing. And in any case, it's been proceeding with that language, but we have gotten a lot of questions and comments and requests. Literally, as we're sitting here in this webinar, we just got an email from someone, folks who are not CHWs and may or may not have a lot of experience with CHWs saying, oh, but we want to be added to the legislation. We would like to be on the board too. And I sincerely believe that these are folks who have good intentions, and I'm sure they're lovely folks and they want to work with CHWs, and that's fine. But I think this sort of thing happens very frequently, that folks who are not CHWs themselves don't have the lived experience of working as a CHW, or even the lived experience of being a longtime CHW ally. So I'll stop there, but just say, it's a very real thing, and it's something that we all just have to really pay attention to and be aware of.
Okay. Venus?
Yeah, I think Carl could also speak about this, but Texas certification program began in 1999 with the fact that they actually acknowledge the gap. And I think every time you acknowledge a gap and you provide some an opportunity for to fill that gap with the community, I think you're going to be better off. We have, I think, the language. I think it's on the website, on the state website, isn't it, Carl? That they have the actual language of the legislative bill and the key words that they use. I mean, if anyone can start using that and advocating and just use those words and say, Texas was the first state, we'd like to see, because in our certification program, the state of Texas doesn't care what if you are legally documented in this country. They just want to make sure that you have an opportunity to be trained by one of the training programs that have been approved for community health workers and promotores. There's several of us here that in Texas that do dual training, Spanish and English. So we want to make sure that in Texas, our community health workers can be of any race, ethnicity, national origin, whatever. The state of Texas really applauds that. So, I don't know, Carl, I'll leave it up to you because you're really good at this.
Well, I'm not sure I'm more qualified than you, but certainly been involved in it long time. Yeah, Texas is somewhat unique in several ways. One, that they still have the option open for someone to become certified based on work experience rather than training. And they're the only state that still has that. Most states have it at the very beginning, but it gets sunsetted after a year or 2 or 3 years, maybe. Texas does not ask questions, as you pointed out, Venus. Texas application does not ask anything about immigration or citizenship status, and it does not require that you submit a taxpayer ID number, and there is no application fee. This has been going on for 20 years. We actually started certifying CHWs in 2002. And there are a few other states that have no application fee, but these are all, really important considerations. And it's also really important to reinforce, and some states still haven't worked out how to do this, to reinforce that you do not have to be certified in order to do the work. You do not have to be certified to call yourself a CHW. You do not have to be certified in order to get hired. And at the moment in Texas, we don't really have Medicaid reimbursement, so that doesn't matter. But states that get established Medicaid funding through state plan amendment, increasingly, they have to tell the federal government what the qualifications of CHWs are. And that doesn't necessarily mean certification. but it means that the state is going to have to set qualifications or requirements in order for a CHW to be paid as a CHW under Medicaid. So it's important for everybody to sort of figure out how you want to handle that, because it can be a delicate issue. And there are a couple of states that use language about being licensed to practice. That scares me. That is not language that is appropriate for CHW certification. Certification is not licensure and should not be described that way. I've said too much already, but thanks for asking.
Thank you, Carl. Angie, I saw your hand up. Did you want to jump in?
Oh, sure. But I do want to yield to like any participants or speakers who had questions first.
Hi, my name is Kenny Chapman. It's not a question, it's just a little comment since all of you are there. Recently, I've been at a convention for NACHW and somebody asked me, what does mean CHW? So I explained what does mean CHW because I believe I'm CHW 11 years, but how Carl says, with certification 3 years. And I do believe education is good because guide you what really is the work of CHW. But coming to my point is, since I'm bilingual and the next language, strong one, is Spanish, even us as a community health worker in organization, we don't have the exact definition in Spanish, which I strongly believe that translation should be trabajador comunitario de salud, because we cannot be trabajador de salud comunitaria, because, and I debate with many people involved in Texas, because Texas called trabajador de salud. A trabajador de salud is a doctor, a nurse, is other degree they require. We can be specialized and do diabetes and stuff like that. But since we're talking policies, we should always check our next strong language, which is Spanish. How we're gonna define ourselves when we use that terminology. And there is better data research, and our mother tongue came from Spain. You can go to the books and see what I do strongly believe should be trabajador comunitario de salud, and no trabajador de salud comunitaria. It's just an opinion I throw there for everybody when policies come, you know, to have all consistency in our programs, in our states, how our name is, because everybody knows us in the Latino way as a promotoras. It's only what I want to say. Thank you.
Thank you so much. Anybody else? Joe.
You know, we're going through this process now in California, and just, you know, back to the old saying, you know, nothing for us without us. And so, you know, when I'm thinking about the certification process, you know, me with a history of incarceration, you know, low hanging fruit for a lot of politicians that don't come from the communities that need us most, with an understanding of the 3 Bs when we think about policy. I think about 3 Bs when I'm looking at policy. I think about 3 Bs as I'm helping men and women come back to our communities. And the Bs are, is the policy a bridge, a barrier, or a bias? Because even amongst our allies who mean us well, the white savior, if you will, syndrome come in to still might have the resources, but tell us what needs to be done. And that's still not the right way. And especially us as community health workers know the pricelessness of meeting people where they're at. And let us continue to meet people where they are at, but let our voice be at the tables that are making the decisions about the resources that are being invested in community health now, as many states are starting to roll out, as Carl knows, and as everyone else knows, roll out with Medicaid, with the billing, and quite honestly, the attempt to define to us what CHWs are, and we can't allow that. You know, there's parts of, I think, community health work that make our work so special. And so many things that are not billable yet, but if not tracked, can be billable one day. Let us be stronger together. Like, I love what the lady said right before me. I love promotores, but we all fall under one umbrella, one sword, stronger together. Let us not separate each other with titles. There have been community health workers since there have been communities. We're stronger together. I say we keep an eye on what's going on in each other's state. And I say we support each other from a distance. And if you're in the state, play a role. Don't play a complaint. Let's get cracking. There's a lot of work that still needs to be done. I think this profession is lovely. I was a community health worker before they were paying me, and I'll be a community health worker well after I retire. If you are a community health worker, you are a healer, regardless of what other terms they may have gave you at what other times in your life. I am no longer Joe Calderon, J28966. Stronger together. Let's not get caught up in titles. We're under one umbrella. Whatever state you're at, stronger together. I love you guys. I love the people that are loving our communities. Peace.
Thank you so much, Joe. That was beautiful. I'm going to take co-moderator's privilege to say that is a beautiful sentiment to end on. I want to thank everybody so much for being here today. All of our speakers, Lucas, Millie, Venus, Lucy, Gary, Honey, I hope that's everyone. I feel like I may have forgotten someone, forgive me. But thank you all so much for your time today. Thanks everyone who joined us. Thank you, Angie, Catherine, Peter for helping organize and facilitate this incredible session. And remember, we've got unity coming up. As Joe was saying, we need unity in this profession. So we look forward to seeing everybody at the Unity Conference in August. Thank you for your incredible work every day, and look forward to seeing y'all again soon. Take care, y'all.